Well, many of us had braces as teens, maybe never followed up on improving our smile again, even as, because the teeth, they still shift and they become discolored after a while.
You know when your parents are like, you need to wear your retainer.
Put that retainer in.
Yep, and I still never did it. I wish I would have. But quality dental care makes it easy for you to get your best smile back. Operations Manager Carla Jones is here to tell us about the options. Good to see you, Carla. Thanks for coming in.
Well, thank you so much for having me.
You know, so you're a certified lumineer specialist is what they call it. And most of us have probably heard of veneers, but I've never really, I don't know much about lumineers. What's the difference there?
Well, with veneers, it's not as conservative as lumineers. The lumineers tend to be much easier on the patient. We can do 2 appointments. It makes it real nice and easy. They're very thin. They're very translucent. They go up across the top of the teeth so that it is just a very natural look. But with a traditional veneer, you have to take away a lot more tooth structure than you do with the lumineers. The lumineers we can actually do with minimal removal of any of an enamel. So it is a perfect way to actually whiten your teeth and make them appear more straight, fill gaps with minimal time frame. It's the quickest turnaround to get that smile you want. And keep it because they don't stain.
So is it just a one-day process? You go in one time? Do you have to come back for multiple treatments? How does that work?
We call it a 2-step process. Ideally, the first appointment is our consult. And we make sure that you're a good candidate and everything looks good, that there's any little hiccups that would cause it to not be a candidate, but for the most part, it's a slam dunk. You get people in, and
so lumineers are basically a face that goes over the front of the tooth, where veneers are more.
They're the same, but they're
invasive.
Much thicker.
Yeah.
And you do have to remove a significant amount of enamel.
Well, should we take a look at this? We brought some before and after pictures today, so we can check out some of those, so we can see the difference here.
Oh,
so
wow.
That is the before and the after, a big difference.
Perfect.
Do you can you whiten your lumineers? Are they going to be just like teeth where the more you drink coffee, the more you drink wine, they are going to get more dull?
That is the bonus point. They do not stain.
What?
You can have your coffee, you can have your red wine.
They don't stain at all.
They don't stain.
The teeth look more healthy, they look fuller. I mean, you're right, the gaps are gone in there.
The one thing, anybody my age or older, I like to tell them that it will take 10 to 15 years off your face when you do these. The brightening of this and the youthful smile, it's back again, and it honestly does take years off your face.
And I never knew that statistic, and it really does. I mean, look at that photo there, and he just looks all around happier, and his skin's bright. He's just brighter all around. But it's such a simple fix.
It is.
Well, what do people say after you hold up that mirror the first time after they've been in and they see the final work?
It is just that huge wow factor. For me, this is the most fun in dentistry because it is so impactful, and it is a permanent change where in 2 short visits, you can have that smile you've wanted and it's yours and you keep it.
I got to tell you, teeth are the first thing that you kind of notice in someone.
Absolutely.
I mean, I think it's one of the most attractive qualities on someone too. I look for a nice, bright, white smile, and I think this is incredible.
And then some people out there, they won't smile because they don't have that bright smile, so they don't smile, they don't light up like they should. And then you have soon you're going to have 4 doctors that are certified on this procedure, right?
Correct.
How many do you have right now?
Right now, Dr. Trum, our main doctor, is the one who is certified and has been doing them for years. So this is something that we're getting all our other younger doctors on board in and getting them certified so that they too can go ahead and do that. For the most part, he is hand in hand with the other doctors so that they are involved in the process as well, and they have input to put in on the case. So it's a group effort for us, and it's so impactful, it's so life-changing. You know, people look at their smile and they'll cry because
I'm sure I can imagine.
Absolutely.
You know, grown men, because it is so impactful and it changes lives.
So for all of our viewers that are out there who are interested in getting started, what do they do? What's the process like?
Well, like I said, the first visit would be our consult. We would do just some very preliminary photos just to make sure everything is good for the candidate of it. And then we bring you back the second appointment. We would actually take impressions of your teeth, and we would take a lot of photos. And then we would also do some of our other little technical stuff we do. Those things are very easy, very simple. There's no pain involved with any of that. We send it out to Denmat, who is the founders of Lumineers, and they will go ahead and they make it so easy for us from there. And then the next appointment is when we actually do the seating and prepping of them. So
well, cars have warranties. I don't know about Lumineers. Do Lumineers have warranties on them if you're not completely satisfied with how they look?
Yes, they do. Actually, Lumineers does back theirs with a warranty. So that is something that is very beneficial to the patient, that each veneer is got a warranty on it.
Yeah.
So.
And you brought in a special offer for our viewers today, and there's a discount if you get 6 or more Lumineers, receive a discount with 6 or more.
Yep, that is absolutely right.
So you don't have to do the whole mouth. You can just pick the teeth that you want to cover, correct?
Ideally, we like to see 8 teeth done,
yeah.
because if you look at the just 6 teeth from your
from left to right.
Right.
Yeah, you want it to blend.
Like if you give me a big natural smile, I see teeth further back.
Yeah, you can see farther
and
back.
And then all of a sudden you've got these really beautiful front 6, but you can see the ones behind.
Yeah, you want it to look natural.
So ideally, you want to do 8. Some people actually need to do more because you can see further back.
Yeah.
So, and you don't want a stark change where, oh, this crown has been here and it's kind of yellowish.
Right.
And then you've got these beautiful, perfectly shaped,
right.
Lumineers on there, and it just stands out. So.
The place for people to start is qualitydentalcare.org is the website that you can go to. That's where you get the ball rolling.
Absolutely.
And then come visit your doctors. Thanks
Yes,
for coming in. Good to see you. Good information
Thank you
about
so
the
much.
Lumineers.
Yes,
Didn't know about all that.
absolutely.
Excellent.